will, understood, the unprimed B lymphocyte will convert into plasma cells and memory B cells. Now from plasma cells only, I'll show you this thing, all kinds of antibodies will be produced, isn't it? For example, in COVID, no? In COVID, what has happened? Persons who are not able to produce their own antibodies, you are giving them plasma therapy, isn't it? Now that plasma therapy is nothing but the antibodies which are being produced from plasma cells. Okay, so there are some paradox that if in natural condition, if a virus is inserted in the body, cell mediated immune response should initiate, but it is not classically this thing differentiated. Okay, so you'll see that cytotoxic T lymphocytes as well as helper T cells will be produced. At the same time, many B lymphocytes will also get primed, and therefore a lot of antibody is also produced. Now that antibody will be isolated by a thing called apheresis, and the purified antibody after chromatography and so on will be reinserted into a patient who has no capacity to develop antibodies due to different reason, difference in the HLA, difference in multiple different things. Okay, so these B lymphocytes is breaking down into memory B cells and plasma cells, which ultimately produces antibody. Now this breakdown needs a protein which is also known as cytokine, and these cytokines are produced from helper T cells, Th cells. Okay, now these Th cells looks like this. Okay, now this is Th cell. There is a good nice nucleus, and there are multiple different things. Okay, one of the receptor is known as T cell receptor, TCR. One is known as MHC1. Okay, one more thing is present on the surface of the helper T cell, which is known as what? Can you remember? Again a surface antigen which is known as what? CD4. Okay, so CD4 antigen are present where? On the surface of the Th cells. On the contrary, if you are having a CD8 antigen, that particular cell will be known as what? TC cell. So this is the main difference between TC cell, and these are important when you will be studying about your this thing. Okay, so that was a Th cell, and the structure of the TC cell is different. Why? Because instead of everything else is same. Remember, MHC1 molecule will be there. ठीक है, इसको बोलते हैं MHC1. चलिए बोल देते हैं MHC1. ये सब में रहेगा, TH सेल में रहेगा और इसमें भी रहेगा, और एक चीज रहेगा TCR, T सेल रिसेप्टर बोल के एक चीज है. लेकिन जो नहीं है इसमें वो है CD4. इसमें है क्या? CD8. So what happens? Okay, so the surface receptor of Th cells are CD4, and the surface receptors of Tc cells are called CD8. Okay, CD means cluster of differentiation. It's only on the basis of the molecular weight. CD4 is having less molecular weight than that of CD8. तो CD8 को थोड़ा मोटा कर देते हैं. To understand that it's having a larger molecular weight. That's all. Nothing else. Okay. Okay. Now CD4 antigen is also important. Can you remember why? You can tell me.
Sir, antigen is also important for the production of antibody.
No. I am telling you, you are missing. Somehow it is right. I'll come to that, but this time I wanted to talk about this.
Yes, sir. I have another answer as well. That antigen is also important because it gives signal to the Th cells for the production of plasma cells and memory B cells as well.
Right. Absolutely right. So one more important aspect of TH cells or CD4 antigens are this: the prognosis of AIDS is dependent on this. ठीक है? Whenever you will check out a patient who's having who's on ART, antiretroviral therapy of any kind, the prognosis is only detected by CD4 cell counting. So you'll suggest the patient to go for a FACS, fluorescent activated cell sorting, or we can also tell it about flow cytometry. Now, flow cytometry is a method which will count a specific kind of cell. ठीक है, वो आप जैसे TCTC और क्या बोलते हैं इसको, हीमोग्राम के लिए बोलते हैं, similarly, but it's much more what you call sensitive. So during hemogram also cell counters will count these eosinophils, basophils, neutrophils, each and every one separately, but they will not able to differentiate between TH cells and TC cells. Okay, they will not able to differentiate between the different kinds of lymphocytes, B lymphocyte, T lymphocyte. They will not able to differentiate. They will only say the lymphocyte total number of lymphocyte is this. Okay. But one more superior technology is there through which you can differentiate between how many CD4 cells are there. So it needs a fluorescent antibody staining. That discussion is not within the scope of this course anyway. But you can just remember for the sake of remembering. Okay. So what exactly happens is the prognosis of HIV is entirely dependent on the CD4 numbers. Okay. So consider that in ART there are multiple different therapies. For example, reverse transcriptase inhibitor therapy, then protease inhibitor therapy, then multiple different therapies are there. Okay. So whether a patient is taking the therapy well, this particular medicine is working on the patient or not, how can you detect? You can detect on the basis of the prognosis. Okay. If you see that CD4 cell count is increasing after having a particular kind of medicine, you will be rest assured that your medicine is working. Okay. So in that case, what will happen if a patient is taking, consider that you have given him a medicine which is inhibiting the reverse transcriptase protein of HIV, and you are seeing that.
Sir, sir, you told that when CD4 will increase, then what is identified?
No. So what happens if an AIDS patient who is confirmed AIDS patient, okay? So he is not only HIV positive, he is showing all the symptoms, what we call as according to the protocol. Okay, now it is an established AIDS patient and he or she need to be having the therapy. And there are multiple different classes of ART. Out of that, one is, let us say, and what we call is reverse transcriptase inhibitors. So there are group of medicines you are giving it the patient, but you are not sure whether the patient should be given reverse transcriptase inhibitor or protease inhibitor. So for a trial for 3 months you have given this particular reverse transcriptase inhibitor, and you told the patient to come after 3 weeks with a report of CD4 cell count. So you are seeing that the CD4 cell count is increasing. In that case, you will tell the patient to continue this medicine for 3 more months, because the objective of therapy is to increase the number of CD4. Why is this? Because in HIV only destroys TH cells. Okay? And therefore the whole immunity collapses. So here you see the beauty of the system. What I said that TH cells are not exactly killing an antigen directly, like natural killer cells, TC cells, or all group of macrophages. It is not doing anything like this. What it is doing, it is only producing a molecule called cytokine, or one more molecule which is known as interleukin. Okay, interleukin. So this is only the function of TH cells. Now, what is the function of these proteins, interleukins and